This presentation is about the Palliative Care Outcomes Collaboration, or Peacock, and my name is Sabina Clapham. So why does Peacock exist? It exists to drive the quality and outcome improvement for patients and their families. It provides a standardised assessment system and produces outcome reports to identify individual improvement opportunities and facilitate service-to-service benchmarking. The figure on this slide represents the 6-monthly cycle of Peacock, where ongoing point-of-care assessments are included in a routine report back to participating services that includes benchmarking and then enables structured report feedback. This is further enhanced by an assessment and response protocol to improve outcomes at a service level. This includes the needs of patients and families being assessed routinely, and those assessments communicated within and between the team and to patients and families. And importantly, the patient's needs are responded to and reassessed. You can find a generic Peacock assessment and response protocol on our website. There are 5 core clinical assessment tools that are used in Peacock. The palliative care phase. There are 4 phases that describe the patient's needs in the distinct stage of their journey. Functional status is measured by the Resource Utilisation Group's Activities of Daily Living, or the Australia Modified Karnofsky Performance Status Scale. Pain and other symptoms are measured by the Palliative Care Problem Severity Score and the Symptom Assessment Scale. So what is a Peacock Logic? The logic is that outcomes drive process improvement. This means that patients and carer outcomes are measured against benchmarks by asking patients and families as well as clinicians. The data of the patient and carer outcome data is used to identify processes that could be better, and then you repeat the cycle. The unit of counting in Peacock is that patients have 1 or more episodes of palliative care, which is identified by the setting of care, for example, hospital or home. And then episodes of care consist of 1 or more palliative care phases: stable, unstable, deteriorating, or terminal. The outcome measured is the change from the beginning to the end of each phase, and then measured against the outcomes of comparable patients. Here is an example of Peacock's data architecture and unit of counting. The green bar represents the palliative care patient, and this patient had 3 episodes of palliative care. Episode 1 might be at home, 2 in hospital, and 3 back at home. And you can see that each episode, the patient has experienced a number of palliative care phases. The change is measured from the start to end of each phase, and those phases belong to the episode and to the patient. There are 20 benchmarks, and each outcome measure is focused on the patient's outcomes regardless of the setting of care. The first one is timeliness of care, then responsiveness to urgent needs, and this is using the unstable phase. The symptom and pain and family care problem measures use the Palliative Care Problem Severity Score and the Symptom Assessment Scale. There are 2 clinical concepts that underpin the outcome measures. Firstly, responsive care. This is care provided to patients with moderate or severe symptoms, and the measure is the percentage of patients with moderate to severe symptoms who have an absent or mild symptom at phase end. For example, in the problem severity score, a moderate range is 2 to 3, and you're looking to reduce that to 1 mild or 0 absent. Here is an example of Australian results over time for the responsive care outcomes. The benchmark is set at 60% for this set of outcome measures, and this one's representing a selection of the symptoms and problems. The second clinical concept is anticipatory care. This is care that anticipates the needs of the patient and their family or carers, and that prevents moderate to severe problems developing. So it could include anticipatory medications, for example. The measure is the percentage of patients with absent or mild symptoms who stay that way. So in the symptom assessment scale, for example, that is 0, 1, 2, 3. And here is an example of the results for the Peacock anticipatory care outcomes, and the benchmark is set at 90%. You can find more information on Peacock's reports from our website, or please contact us. Thank you.